Okay. You come in, Mindanao Commission on Women, based in Davao City. Hey, Fatmi, are you there?
Yes, I'm here, Doctor.
Okay.
Kaya na pa ready ang Davao City. Yes.
Ganon. O sige, wag ka nang maraming sasabihin. Marami nakikinig.
Yes.
Okay, go ahead, go ahead.
So, mabuhay from the Republic of Davao, galing sa aming Mayor Rodrigo Duterte, na very sikat sa anti-drugs, no? Kinukumusta namin si Congressman Belmonte po, na partner din ng Mindanao Commission on Women at ng kababaihan sa Mindanao, para po yung power, kasi nawalan po kami ng power doon Mindanao. Oo. So, magtatanong po ngayong umaga ay si Dr. Jean Gulanes, galing po sa Davao City Drug Treatment and Rehabilitation Center. At susunod na magtatanong din ay si Mr. Earl Vincent Ang, isang freelance researcher na very interested sa scientific uses ng marijuana. So unahin po natin si Dr. Gulanes.
Hello, good morning sa inyong lahat. First, tanong ko sana kay Ms. Donnabel Cunanan, yung Philippine Cannabis Compassion Society, asking regarding scientific studies or evidence-based regarding the medical use of marijuana. Scientific studies or regarding the medical use of marijuana.
Hello, good afternoon. With regards to scientific studies, medyo limited pa rin talaga yung studies natin dyan. Although there are several research journals that publish na meron talagang effect, and there are also several journals who would say na walang effect. That is the reason why sa amin po, sa research industry, we want to apply all measures na kinakailangan natin gawin just to provide you with necessary data. Because without that clinical trial, we cannot give you anything. Okay? So yun po yung major issue dito. Much as we would like to answer your question about kung meron na ba talagang medical benefits yan, definitely meron po. There are several countries who have already conducted them, pero gaya na nasabi ko kanina, medyo limited po. Limited yung researches because of ethical issues. Now, that's what we want to prove, yung medical benefits ng compound or components ng marijuana, not marijuana itself. We could only provide that if bibigyan tayo ng right to conduct that particular clinical study under controlled environment to provide the basis dun po dun sa ating sinasabi na.
Okay, Patni, was the question answered?
Yes, not answered, but sabi wala pa. So, ano po ang
question po. Hindi po sinasabing wala. Limited lang po.
Limited.
Sa Pilipinas.
Limited po.
Sa ibang bansa. Okay, next
Pero
question.
that's why we would like to conduct clinical trials nga po regarding sa mga compounds ng marijuana.
Patni, next question please.
Next question ay galing kay Mr. Ang. Ayan po, ayan.
How many years does it take to study a plant?
So how many years po daw would it take to study that?
To study a plant.
A plant.
How many years does it take to study a plant when one of the chemical components is isolated in Israel since 1930s? So how many years na tayo na ni-research ang plant na to? And Israel, one of the countries is giving this to patient na may mga iba't ibang sakit. So, dito sa atin, how many years does it take to study this plant and to know the properties?
Drug development po kasi, it takes years. Between 5 years to 20 years, depending upon yung sa complications po nung drug na tinidevelop.
Di pa tayo na lahat ng may kailangan nun.
Pero pwede po, yun nga po that's the reason why we want yung controlled legalization nga niyan, para po mabigyan kami ng chance sa clinical research industry to conduct all necessary trials. Sa technology po natin ngayon, sa advancement po ng technology, yung previously, no, nung mga panahon pa po nung before ako yung mag-medicine, it really takes about 20 years to develop a drug. Pero with the advancement of technology and given the proper support of the government, we can lessen that period. depende na lang po sa kung anong compounds yung i-extract natin and for what particular use. Kasi may mga specific subjects po tayo na kinakailangan.
At saka hindi naman po tayo nag-uumpisa sa zero. At tulad po nung binanggit nyo ni Congressman Albano, hindi naman tayo gawa ng original research sa heart disease, hindi naman tayo gawa ng original research sa hypertension bago natin tinanggap yung gamot. Meron na kasing mga existing studies. What we need to do is to collect all information, all scientific data, and validate it and apply it in the Philippine situation because the need of patients is paramount. O kailangan merong compassion sa pag-approach natin dito.
Opo. At gusto ko rin pong sabihin lang, no? Sabi po ni Dr. Go, FDA kanina, for compassionate use, we can apply. But very clearly, DOH, sinabi po nila, medical marijuana is not part of that compassionate cure. So, ibig sabihin, hindi kami pwedeng pumasok for compassionate cure. And the best way for us to have a safe and legal access for our children is to actually enroll our kids na para po doon sabihin na natin guinea pig, willing po kami bilang magulang kasi we have already exhausted all medical options eh. So, siguro naman po para po sa mga doktor sa DOH, hindi naman po siguro kasalanang tumuklas tayo ng bagong gamot na pwedeng maging solusyon para maisalba yung buhay ng mga bata. So, yun lang naman po ang inaapila namin. Kung gusto niyo po, wag niyo munang illegal, mag-scientific research lang tayo base po dito sa RA 9165 and then habang pinag-aaralan, nabibigyan natin ng chance yung mga bata. Sabi nga po ni attorney, this is a cry for life, this is a right for health. Kami pong magulang, kung di namin ipaglalaban yung karapatan ng anak namin, sino ba pong maglalaban? Yun lang po.
Okay, can we, Senator Sagisag, would you like to say something ulit po?
Hindi, yung nagkakagulo yung dalawang agency ng government, ano? Sasabihin nito, DOH, hindi pwede. Sasabihin nun, ano? Sasabihin ni Senator, pwede. Sasabihin ng Congressman, pwede.
No, let us clarify ni.
Talagang ganyan ang gobyerno. Oh, kabis.
Ang pwede, sabi sa...
Okay. Sorry, sir.
First of all, kumusta ang mga taga Davao City, the capital of Mindanao?
Republic of Davao, yes.
According to the Food and Drug Administration, pwede gamitin ng medical marijuana siguro in a finished form or totally wala. Pwede in a finished form. So, under the compassionate use, maybe we suggest that there is no need to amend the law, I believe. Why? It's up to the DDB to either exclude that cannabis in the dangerous drugs list or maybe include them as a medicinal in the list. So it's up to the DDB because they are the policy-making body. So, mas mabuti siguro pakinggan natin ang si Dr. Reyes at saka si Deputy Director. Okay, to Dr. Reyes.
Thank you. And again, there is no inconsistency, no? Sinasabi kasi kanina ni Yusek Kako, yung medical marijuana, yung sinasabi ni Senator Soto kanina eh. Marijuana as a whole, hindi talaga pwede. No? Ngayon kung ine-extract natin yung active components and finished product yan, medicinal form. In fact, if you already know of drugs available for epilepsy, no, sa US, like gusto niyo ipasok dito, yes, under Administrative Order number 4 ng Department of Health 1992, pwede yan, compassionate use, no? At the same time, I agree with Congressman Belmonte, hindi na natin kailangan ng bagong enactments dito, no? We already have the mechanisms I've already mentioned. We already have the guidelines, no? All we need to, ang tagal na natin pinag-uusapan ito eh, no? November, hanggang ngayon wala pa rin nagsasubmit sa inyo eh. No? Ng event protocols. No? And then, in-explain na namin sa inyo noon pa yung guidelines ng Dangerous Drugs Board, no? As for Section 16 ng 9165. At the same time, as mentioned by Congressman Belmonte, under Section 93 of the law, yes, the board has the authority to reclassify, add, or remove substances, no? But may kolatilya sa Section 93, no? We need to follow international conventions. Now, for the information of the body, the issue of marijuana will be discussed sa UN, actually. No? In fact, sa March, atin si Si Kong Belmonte ang head of delegation, no? Sa Vienna. And this will culminate on 2016 sa UN General Assembly. So it's already on the table, no? This issue on marijuana.
Okay, can we, oh sure, please. So do you agree, I have a question for Nidibek. You agree that there is no need for new legislation?
I would think that there would be a need. No? I agree with the handsome gentleman to my to my right. That indeed, Section 93 of the Republic Act 9165 allows the Dangerous Drugs Board to reclassify. However, it's not as simple as that, no? I fear it will run the risk of being struck down as unconstitutional, that provision, because the drugs are based on the 1961 UN Convention on Narcotic Drugs. So what you're effectively asking the Dangerous Drugs Board to do is to supersede a treaty or be superior than the United Nations. So medyo yun, delikado yun eh. Unlike if there is legislation, no, kung bagang ating mga legislatura, sila mag-i-enact ng law, hindi siya magiging issue, no, because we adopt the doctrine of transformation in international law. So kumbaga hindi lang pwede ang any executive agency to just overturn a treaty. So that would be the difficulty.
Okay. All right, so here's another view that there is a need.
Question of law, but the issue is, here is the legalization of that medical marijuana. It's not marijuana per se. It's only the finished form, the medicinal marijuana, not the marijuana. Tama po kayo, the different states in the US can do that, no? I don't know how was the procedure. It was through legislation or no, state legislation for an election. No, state legislation.
Okay. May I call on some other members of the audience? No? Because can I call on Professor Leiko of the Asian Institute of Management, who is on healthcare policy?
Good morning. Thank you. Just a quick observation. I noticed that the discussion coming from the government is taking off from the point of view of what cannot be done. Why are we starting with bawal? No? Hindi pwede. And I quickly visited the website of the Food and Drug Administration, and I'm quite disturbed by the statement by the respected Director General, my colleague, that they base their decision on science and not on emotion. And I find it quite disturbing also that there is a compassionate use pala. Kung may compassionate use, that right away suggests that there is emotion. And I cannot quite accept that people in the caring profession, no, doctors, would say that they base the decisions based on science. I think definitely I would like to see more decisions based on science, but you cannot take off purely on science. It's a caring profession. I've been involved in the health policy development mostly on access to healthcare. And this is beginning to be a repeat of what the government take-off point is. It's always like, bawal, hindi pwede, kasi mababankrupt. I don't think so. The other observation I would like to make is that, why is it that the burden of finding what is effective, what is safe, rests on the patients, rests on the citizenry? The government should have most of the resources more than the citizens. And therefore, the burden of finding whether or not medical cannabis is safe, effective, should rest on the government, and the resources of the government should be utilized to find out what is effective use of medical cannabis, and not on the patients. No?
Okay,
Thank you.
That's another view. Can we hear from, please. Please identify yourselves, because you might be selling marijuana in the streets of Kamuning. So,
Okay.
identify yourself.
I'm Dr. Rainier Villanueva of the Chamber of Herbal Industries of the Philippines.
Oh, welcome po.
Our group is, we're a group of companies, association of companies that deals on herbal. We manufacture, grow, and sell herbal products. And our products are registered with the FDA. Okay. Now, ang agam-agam ho yata dito ay ng ibang sektor, halimbawa ni Senator Soto, is baka mamaya ang pag-grow nitong marijuana ay mapunta sa hindi tamang mga kamay.
Opo.
Pero naman, on the other hand, may nangangailangan din talaga ng sektor o mga pasyente ng ganitong klaseng mga gamot. Ano ho. Ngayon, alam ho natin, may ahensya ng gobyerno na inatasan para mag-develop, na magpalago ng herbal industry sa Pilipinas. At ito ay ang PTAC. No? This is an attached agency of the Department of Health. So, kung ang pag-uusapan lang ay growing ng a certain quantity for research, PTAC, I think, is mandated to do this. They have the right to grow, and I think they have also the capability to standardize the extract of marijuana. So, kung ang pag-uusapan lang naman ay, like sila Dr. Corral, they need a sample. Kasi kanina sinasabi ni Ma'am dito, saan kami kukuha para ng material, ng sample para ma-research, magamit namin for research. I think PTAC can provide this. At nabanggit din kanina ni Director General Go about the role of PTAC. And this is very timely then for PTAC really to have sample, to provide samples of this cannabis for research.
Thank you. And can we hear from the party list, the representative of ang nurse?
Thank you, ma'am. Magandang umaga po. Yes, we should be evidence-based. But with the parents here today, whom their children need this medicinal cannabis, I think it's very important that we solve that today. I will be with you in whatever you will be doing with, of course, with our chair here and the members of the Dangerous Drug. But I can feel how you feel as a mother. Kahit ano pipilitin nyo magpa-clinical trial, kahit alam nyo anong mangyayari dyan, mamamatay ba anak ko, mabubuhay, I know you will do everything. And I support you because I also have a son now who has cancer. So, let us do everything. Of course, our good chair here will be supporting us. Ano ba talaga ang gawin? Hindi na dapat pag-usapan yung evidence-based and legal implications. But I know these parents today, ang gusto lang nila, mabuhay mga anak nila. So, yun lang po.
Salamat po.
Good morning po.
Good morning.
Bali, may anak po kasi akong 12 years old na po siya today, by April. Bali, she's an epileptic child. Nag-start po yung epilepsy niya, 8 months old. Bali po lahat na ng gamot nagamit na namin. Nagano na rin kami sa US at sabi nga mayroon daw doon. Kaya lang hindi rin po afford na makapag-import dito. Pwede po kaya bakit po kasi magkakaroon tayo ng split di ba po? Pwede naman po 'di ba mag-unite ang government and yung pong cannabis compassion as a one para po ma-expedite po natin yung pag-formulate or pag-research po nung medical marijuana. Kasi po, hindi naman po, tulad ko po, everyday nag-aano po yung anak ko, nagsi-seizure po siya. She take po 2,680 milligram a day. Halos bangag na po yung bata. Grade 4 lang po siya instead of, sana po in a higher grade na po siya. Kumbaga, pwede naman siguro mag-unite na lang po, di ba po? Hindi na kailangan pag-usapan yung para at least po ma-expedite po natin yung kasi kawawa rin naman po yung mga may sakit. katulad din po nga ng anak ko, na naghihahanap po kami, katulad nga ni Ma'am Cynthia, naghahanap po kami kung anong pwedeng igamot. Kasi ang dami na hindi, parang ang bata, pag nakita niyo yung anak ko, kita niyo ano siya, normal, pero lagi siyang nakaganoon na nagkakaroon na rin siya ng behavioral change, na parang minsan nagagalit na siya, sabi niya nga sa doktor niya, gamot na naman, wala, kumbaga parang gamot na naman, wala na ba akong ibang alternate na pwedeng gumaling ako? Nagkakaroon na siya ng depression. Siyempre, para po sa isang magulang po, hahanap po, gagastos po. Ako po, single mom po ako. Lahat po ginawa ko na naiwan ng pera ng asawa ko. Nilaga ko na po, ubos na. Kumbaga, kung meron pong alternative na makakatulong sa anak ko, di bali kung walang pera. Basta po, buhay po siya, nakikita ko, normal yung bata.
Marami
Yun
pong
po
salamat.
sana po
Marami.
magkaroon ng ano
Yeah,
po.
pero sandali, teka muna, si Dr. Go ata gustong sumagot, tapos si Congressman Belmonte, tapos sandali lang mga iha, kasi we have to go back to the regional sites, ha? Pero maaga pa naman meron pa tayong isang oras na hindi magkasundo. So, anyway, I mean, seeking solutions. It's please, Dr. Go.
Position of Professor Leco here, and I'm sorry that you're disturbed.
Nasaan siya? Nawala si nandun. Okay. You're sorry, you're disturbed. Sa AIM na lang yung pag-usapan niya mga disturbance nyo. Okay? Pareho naman kayong taga rito, no? So, mag-coffee na lang kayo. Congressman Belmonte, kayo
Yes,
po.
sagutin ko po yung sinabi ni
Yeah, oo.
ni Madam nga dapat ng
Opo.
gobyerno magkaisa na. Yeah, tatama po yun nung hangarin mo. Pero sa totoo lang po, ang gobyerno, gumagawa kami ng paraan. That's why nga
Yeah, that's true.
we organize this
Yes, that's true.
policy forum. Anyway, the good Congressman Albano eventually will file his House bill. At saka naman sa part nyo, susulat na kayo ngayon. Yung gobyerno, hindi pwedeng walang check and balances. Ang role sa gobyerno sa medical marijuana or marijuana, dahil listed siya as dangerous drugs, is to regulate. And at the same time, secondary, yung research siguro. So, dalawa yung ginagawa ng gobyerno. But primarily, nakatutok ngayon doon sa regulation sa mga dangerous drugs. Pero kung mayroong maganda, ma-prove nyo nga mayroong magandang gamit ng marijuana, that will be the secondary position sa government, tutulong sila sa research.